Aortic stenosis. What is aortic stenosis? This is where blood flow through the aortic valve from the left ventricle becomes severely limited, either due to narrowing or obstruction of the valve. Etiology. What can cause aortic stenosis? The majority of cases in the developed world are a result of aortic sclerosis, which is an age-related degeneration of the valve over time. The valve becomes thickened and sclerotic, which impedes blood flow. Most cases of aortic sclerosis occur in patients greater than 70 years old with a congenital bicuspid aortic valve. In developing countries, the major cause is rheumatic fever. Symptoms. Patients can initially be asymptomatic, particularly in the congenital version. As the disease progresses, patients can experience exertional syncope, angina, or dyspnea. During the physical examination, a trained physician may hear a crescendo-decrescendo murmur with a paradoxical splitting of the S2 sound, and a pathognomic ejection click, also referred to as S4. A Galavardin phenomenon may also be audible, which is a musical sound best heard in the apex, which becomes absent parasternally. Diagnosis. The best diagnostic test for identifying aortic stenosis is echocardiogram, but should be supported with an ECG and a chest X-ray to rule out any other conditions. Blood tests should also be ordered, as the reported symptoms may mirror a myocardial infarction, and troponin levels should be checked. Cardiac catheterization may also be considered prior to intervention to assess any comorbid coronary artery diseases. Treatment. Treatment can be supportive or surgical. Supportive treatment with nitroprusside to reduce afterload, digoxin, diuretics, and ACE inhibitors can be controversial, as there is no evidence that they improve survival. But these treatments may offer symptomatic relief. Surgical intervention involves replacement of the valve, but this is only considered where symptoms are severe. Surgical interventions include balloon valvotomy or valvuloplasty. This is where a small balloon is inserted into the valve and inflated. This directly widens the diameter of the valve. Valve replacement, using a mechanical or bioprosthetic valve. Most of these come with complications, such as risk of thrombosis or tissue rejection. A mechanical valve candidate would be required to take lifelong warfarin prophylaxis, which makes this less suitable for children. The Ross procedure uses the patient's own pulmonic valve to replace the stenotic aortic valve and has less complications. I hope you enjoyed this bite-sized revision video on aortic stenosis. Feel free to leave a comment, like, and subscribe if you'd like more videos like these. Also, head over to my Quizlet link in the description for more revision flashcards. Happy revising!